Hello, everybody. Welcome back to another episode of the Rehab with Roni podcast. I'm Roni, short for Veronica, although many of you still think that my name is Roni, and that's okay. But that's not why I'm here today. Today, I'm here to chat about lifting weights, exercising, staying fit, being so strong while also being pregnant. And I kind of am surprised that in the year 2025, this is still a subject that has people confused, a point of contention for some people, a topic that not everybody fully understands. And so I would like to kind of give my little physical therapy synopsis on why I think it's important to continue weightlifting and strength training and being active all the way through pregnancy as much as you can. I got this idea for the topic because I received several direct messages on Instagram after I had posted a garage gym home workout of people saying, "You need to be careful how much weight you're lifting. Are you sure you should be lifting that? The baby's gonna be suffering." It's just like, are we for real right now? I did not grace those people with a response. I was just kind of like, this seems like a great opportunity to educate the general public. And so that's what I'm here to do today. First and foremost, it's important to always consult with your OBGYN or midwife before starting or continuing an exercise program while pregnant. So, all of that, everything that I'm about to say is true for somebody that has been cleared to exercise. So if you are pregnant or if you know somebody who is and they are like, I'm going to start getting into this HIIT class, cool, but make sure that their doctor thinks that it's a good idea first. So I'm not here to be your OB. They are the experts in that field. I'm just here to talk to you about a physical therapist's point of view on exercise while carrying a fetus. uh, let's just start with some common myths that I hear still to this day. I hear things like exercise can hurt the baby, breathing too hard is going to deplete the fetus of oxygen. You should avoid lifting anything heavy because it puts strain on the baby. You need to take it easy for 9 months. And I think historically, these were much more normal and widely accepted. I mean, think about where your parents probably were when your mom was pregnant back in the I don't know, depends on how old you are, but my mom was having us in the 90s. Actually, Janet was super active the entire time. So maybe she was an outlier. But I think a lot of people in the 70s, 80s, 90s did avoid exercise for fear of the unknown. I just don't think a ton of research is done on exercising pregnant women, or at least it hadn't been back then. And so people were just erring on the side of caution. And I think that's totally fair and totally fine. But now those same people are grown-ups and they're telling their younger counterparts to not exercise. And I think the research is there and the data has changed, and now we can support positive exercise reinforcement a little bit more. Now that we know a little bit more about how strength training can be positive in pregnancy, I think it's important to touch on a few key points. So, it has been shown to help improve circulation and reduce swelling. And I'll just speak from personal experience here and take this with a grain of salt because this is my first pregnancy, but I am now 28, almost 29 weeks pregnant, and I have not had any swelling yet. And I'm sure that's totally person specific and it's going to depend on a lot of other various factors. But I flew to Palm Springs a few weeks ago, and so many people were like, oh, prepare for the swelling, bring compression socks, you're going to be so uncomfortable. I never experienced that. And I'm not going to be able to do a randomized controlled trial to figure out whether that was because I've been exercising or whether it's some other genetic environmental factors, but it is interesting. I haven't had any swelling whatsoever, and I'm now in my third trimester. So I'm sure that will change as I blow up like a balloon, but improved circulation and reduced swelling can be one of the side effects of strength training. Also, better posture and less back pain. And I also want to speak on personal experience with this one too, because in my second trimester, kind of around the beginning to middle of it, I started to have this debilitating back pain. And I couldn't pinpoint why, other than pregnancy changes, because my exercise had stayed about the same throughout. I was lifting less weights, but nothing severe had happened. I hadn't injured myself. I just woke up one day and I was like, "Ow, my back hurts." Anyways, I go to a Pilates class. My sister-in-law says, "Ronnie, just try Pilates. It saved me postpartum. I wish I had done it while I was pregnant." No joke, the next day, back pain gone. Again, anecdotal evidence. This is a one-time case study, singular occurrence, but I thought it was interesting. This was just a different type of core training I had never done before. I'm more so just a go for a run in my neighborhood, lift some weights with my personal trainer, go to a CrossFit class every now and then. So Pilates was a totally different stimulus on the body. And for me, super helpful with back pain. So I didn't just go to that one class. I have been continuing to go for, I don't know, 2, 3 times a month. Not as much as I would like to, but it's been really helpful for me. And back pain has been kind of non-existent. So yay me. Strength training can also improve pelvic floor strength, improve core strength, which can aid in an easier labor and delivery and recovery. I can't tell you how many times I have talked to women, patients of mine, friends of mine who have children, and they say one of two things. They say either, "Oh my gosh, labor for me was a breeze, and I really think it was because I stayed active," or they say recovery for me was just, it didn't take 6 weeks. I felt like after 4 days, I could get back in the gym. Although I didn't, I felt as if I could. And I think I can attribute a lot of that to the fact that I stayed active all the way up until basically delivery day. And I think there's something to that. Never have I met somebody who said, "Oh gosh, wish I hadn't exercised during pregnancy. That really, really threw me under the bus. It really made things so much more difficult." It's always the opposite. Moving on. Reduced risk of gestational diabetes and preeclampsia is associated with strength training while pregnant. And that I think is a great positive. You don't want gestational diabetes or preeclampsia. So, strength training. On top of that, it's been shown to improve mental health while pregnant, decrease stress, improve sleep, and increase confidence. I can speak personally on that one as well, but I think that goes past from when I found out I was pregnant. I mean, I've always been somebody who, if I'm not exercising on a regular basis, like if a few days go by, maybe I'm traveling and I haven't gotten to get my heart rate up in the way that I need to, I start to feel a little depressed. I don't know. I feel not myself. I get aggravated easily, and it's definitely an absolute stress relief for me. So that's just been something that's continued through this pregnancy. I found out I was pregnant and didn't really change my workout schedule that much because I know how helpful it is for me mentally. Okay, last little benefit here. Strength training while pregnant also helps maintain muscle mass and strength, which is key for postpartum life. Think about it. If you are, let's just say, let's just use me as an example. Let's say I found out I was pregnant and I stopped exercising altogether. I just went for walks every so often, but not even a hard walk, just like a quick little walk around the neighborhood. Although in my neighborhood, there's no such thing as that because it's all hills. I basically live on a hill. But if I had never strength trained and then I go and I have this baby, and then I'm for the next 12 months bending over, lifting, reaching, holding, carrying, my body's going to be a lot less prepared for that than if I was consistently in the gym doing things that somewhat mimic caring for a child. And obviously, a newborn doesn't weigh that much, but by the time they're 1, 2 years old, they can be chunky little monkeys. And so, yeah, the strength training portion of it just seems logical to keep your entire body used to that sort of stimulus and prepare for that sort of load to be placed on the body. I feel as if the lifting that I'm doing now is going to help reduce my risk of throwing my back out bending over the crib 75 times a day. So we'll see. Stay tuned for that. Let's get into what the science says. The ACOG, that's the American College of OB and Gynecology, their guidelines, they recommend 150 minutes of moderate intensity exercise per week for pregnant women. Studies showing resistance training improves outcomes and reduces complications. So 150 minutes a week, if you divide that by, say you just want to work out 4 days a week, that's just 37 and a half minutes a day. You could make half of that time a little bit of a cardio focus, maybe we're walking on an inclined treadmill. Maybe we're doing a little stairmaster, whatever feels good to you. And then the other half of that time is some strength training, some free weights, maybe a little Smith machine action, maybe some push-ups, whatever floats your boat. Maybe throw some Pilates in there. But I think that breaking it down into those time frames kind of helps it seem a little bit more easily digestible. 150 minutes sounds like a lot, but when you spread it out over the course of a week, it's really not that bad. I do think that two considerations need to be considered when you're thinking about moderate intensity exercise. Number one, your cardiac capacity when you're pregnant is going to be reduced. You have increased blood volume throughout the body. Your heart rate, your resting heart rate is higher as it's helping support the life of this child. And so the normal hill runs that I do in my neighborhood where I try and sprint up the hill and I listen to my screamo music and I try and just go nonstop until I get to the top. I can't do that right now. I try, but it I don't have the cardiac capacity. It's more like a very light jog and I'm huffing and puffing trying to get up there. But that is still moderate intensity for me. So I'm not trying to sprint. I'm not trying to reach high intensity because that's not going to be necessarily beneficial or safe. It's okay to get your heart rate up, but trying to push yourself to the extreme, probably not super smart. Secondly, some of you may know this, some may not, but the hormone relaxin is a hormone that is present and starts to increase, I think, around the 12th week of pregnancy and continues to increase until birth. And what that does is, I mean, I guess the purpose is in the name, relaxes. It helps joints that typically have a little bit more stability open up a little bit more and prepare the women's body for birth. And that's a great thing, but it can also be a sort of painful thing during pregnancy. I have felt some of that extra movement in my SI joint, in my pelvic girdle, and it's not super fun. And it can be a little testy when you're exercising. So, this is key when considering what do I want to do for strength training and what feels good. I think that's the main point here. That's overarchingly the concept that I want everybody to take home. What feels good is going to be what I think you'll be more motivated to do and you'll be able to maintain. So if I'm doing heavy back squats and it feels as if my lower half is ripping apart, which it did when I tried them, I'm not going to do those. But there are so many other variations of lower body strength training exercises I can do that don't make me feel like my joints are splitting in half. So think about relaxin, think about its role in and what it's doing to the body and then how you can sort of work around it. So oftentimes women experience more pain in the lower back and SI joint with unilateral work, so step ups, lunges, side lunges. And so then you just might want to consider incorporating more bilateral activities, leg press, a goblet squat. Other modifications you might want to consider avoiding exercises on your back after the first trimester. So, if you've been pregnant, you might have experienced this. And if not, it's important to know laying on your back, so lying supine for extended periods of time can lead to compression of big blood vessels in the body. So, think about how the baby gets bigger and it's just laying there, it's being all cute, it's all curled up, but then you lie supine, gravity is pressing down, and so is the weight of that fetus onto your abdominal aorta and your inferior vena cava, which are big blood vessels that are important to supply oxygenated blood to the mom and the baby. So I have felt this. I've woken up in the middle of the night, been on my back, and been like feeling a little lightheaded, feeling not so great. So while you could probably do a quick little bench press here and there, you don't want to lie on your back and do supine leg lifts and crunches and stuff for 10 minutes. It's not going to be super beneficial, and there's other ways to get those exercises, those muscle groups worked without compromising your vascular system. Other just general principles I think are important to consider are not training till failure. So in pregnancy, while I do love a good deadlift, a good back squat, I'm not probably hitting my 1 rep max during these 9 months. And I'm probably not hitting my 10 rep max either, trying to see how far I can go before I almost pass out. Really just aiming for moderate exertion. and focusing on breathing, focusing on form. Again, back to the old saying of just doing what feels good for you in that moment. Some things you want to watch out for: dizziness, bleeding, cramping, shortness of breath before exertion. And I want to touch on the bleeding portion of this. I didn't know this, but you can get what's called a subchorionic hemorrhage. Not to scare people, but I had this my first trimester, and it's like a little hematoma that forms, I believe, in the uterus or outside the uterus. I can't remember exactly, but anyways, it causes bleeding with exertion. So I was lifting weights and I was having some bleeding, and it was terrifying. And turns out totally normal, but you do have to take it easy. So I had to go 6 weeks with pretty much no exercise so that that could absorb into my body and everything could form, the placenta could form healthily. So that's a fun little personal story where there was some exercise induced, well, I wouldn't say exercise induced. This hemorrhage formed independent of my activity level, but the exercise and lots of activity can irritate it. And so that was something I had to modify in the beginning. But here I am at 29 almost weeks, doing great, loving life. I think we've covered a lot of the basics here concerning strength training, exercise with pregnancy, but I think there are still some common concerns. Two things I hear a lot that I also want to bring into the conversation are: what about abdominal exercises? Like, can I do those? Is that safe? What if I start toning? So I'll touch on that a second. Contrary to popular belief, everybody has abs. Everybody has abdominal muscles. We all have the same anatomy. Some are just more visible than others. You know what I mean? But, anyways, part of that anatomy is a long vertical band of fascia called your linea alba, and that connects two sides of your abdominal muscles together in the middle. And what can happen with pregnancy, as your abdominal cavity starts to expand, that linea alba can separate a little bit. So the rectus abdominis, which is a abdominal muscle, will pull apart on either side, creating what's called a diastasis recti. And it's really common in pregnancy, but it's something that you want to be aware of when you're doing exercises that increase that intra abdominal pressure, like crunches and leg lifts and those kinds of things. When it starts to push through, that's called coning. And it's more evident when you're doing abdominal exercises, especially if you're just kind of bracing and not breathing and pushing out. And so that's something I think you should consult with a physical therapist about, because there are ways to brace and activate the abdominal muscles, each layer, and get them working and get that core engaged without excessive coning. But you need to be safe about it, because you don't want that to you don't want to increase that separation more. It's normal, but excessive intra-abdominal pressure could make it a little bit worse, which would just make recovery afterwards a little bit more lengthy. And lastly, I get questions asking, what if I wasn't working out before pregnancy? Is it okay to start? And to that, I would say, again, consult with your OB first. But the human body was built to move. So I don't think that no is going to be a common answer. Obviously, if you didn't do anything before your pregnancy, but you're wanting to stay moving to be comfortable and be healthy, don't go hopping on a CrossFit class or try to do a bunch of gym exercises by yourself. Educate yourself first. Do what feels good, which is the whole mantra of this episode, and talk to your doctor about it. But I'm a huge proponent of it, obviously. It's helped my pregnancy in so many ways. And so I think it could be really beneficial for you too. To cap this one off and close it off, I want to remind people that our bodies are strong and we're capable human beings. Females were designed to be able to procreate, carry babies for 9 months, and then pop them out. And modern day medicine and information can get confusing, and it can be hard to know what's right and what's not. And when it comes down to it, I think our instincts say a lot. and I've said it 100 times this episode, but you'll know what feels good for your body and what's right and when you've done too much. And I'm learning that now as I sometimes push myself a little too hard, not even just in the gym, but just throughout my daily life and staying active and maybe not taking enough rest breaks. So I am on the journey of learning alongside with you guys, but women have been having babies for millions of years. And I mean, gosh, they did it in teepees and probably had to scale cliffs to get to their huts. So we can we can go for a walk and do some body weight squats and be in good shape and be happier and healthier postpartum for it. So if you have any other questions for me as a physical therapist about exercise with pregnancy, send me a DM. I don't see a ton of pregnant women on my caseload in my clinic, but I am a pregnant lady myself. And I've learned a lot about my body and it's been really fun. It's been such an enjoyable journey. I can't believe I only have like 11 weeks left. That kind of freaks me out. But part of the reason I think it's gone by so fast and so smoothly is because I've been exercising. So basically, this entire episode has been a campaign ad for staying fit while carrying a child. Love you guys so much. I will see you on the next episode.